We're very lucky to have Anna, who is good friends with Steph, also one of our LPs. And Anna is going to go ahead and moderate this panel, kind of more about longevity and health with Dr. Rado and Vicki. And why don't you guys start making your way up? Anna Gudmundson has spent over 2 decades in the international high-growth tech scene, most of which is in senior management and C-level positions. Her present-day focus is on transformational technologies that impact the world in a significant positive way while having strong commercial viability. She's the CEO of Sensate, which, did you bring one? Are we going to get to check that out? Or no? If we have time. Okay. I'm curious about this. A consumer stress management technology company, literally tackling one of the biggest challenges of our time, which is stress and mental health. Aside from a passion for the technology business, she has a big curiosity for personal growth and human potential, and basically is combining cutting-edge science and technology with ancient wisdom. I noticed you said that you're a certified breathwork teacher as well, which I love that stuff. So yeah, off to you, Anna, and thank you to all of our panelists.
Let's see, yeah. Okay, well, thank you so much. All right, so let me do a quick intro here and try to keep this speedy. So, Vicki, before launching Lume Health, Vicki was an engineer at Apple, developing the next generation of sensors at Apple Watch. She holds 3 patents in wearable sensing. Today, she's building what no one yet has built, which is a continuous hormone monitor wearable, starting with cortisol and circadian rhythm. So Lume's ambition is to make the invisible visible, translating the body's most powerful biological signals into real-time actionable data. And then we have Dr. So it's Radoslav or Rado? Rado, okay, there we go. Is a double fellowship trained vascular neurologist and neurointerventional surgeon on faculty at UCLA. He is also the co-founder and CEO of Neuronics Medical, where he has built Fast AI, which is a smartphone-based platform that uses machine learning and computer vision to detect acute stroke symptoms in real time. And stroke is apparently fully reversible if treated within 3 hours. And so his work is really closing that window, which is amazing. So thank you. And then I think, Amanda kind of did most of the intro here, but very delighted to have Andy here, who is, one of the world's foremost authorities in human performance. And, as Amanda mentioned at Red Bull, but I would also mention he works with Olympic athletes, special operators, Fortune 500 CEOs, and he has recently also been named a general partner at the New Human Performance Fund, 3P. So soon before, it's not fresh off the press, not even in the press yet, and also an LP at Liminal. So very lucky to have you all in the room, and I'll actually kick off with you, Andy. You worked at the absolute forefront of the edge of human performance. And so what are just some common misconceptions about stress recovery, and what does it take to sustain high performance, and maybe your personal or specific angle on that?
Yeah, well, good afternoon, everyone. I'll just preface it with my lens is very much right at the edge of human optimization, so think of it as a sort of Formula One, but it's on the same spectrum as health. So typically what we're seeing is the stuff that hits healthcare 5, 10, 20 years later. So it's a very different lens, but in the context of that, the easiest answer is probably there's no such thing as sustained high performance. It doesn't exist. And the reason being, to perform at your very, very best requires a lot of different things to come together in a very unique way. And the old saying was, train hard on the easy days, you're going to train easy on the hard days. You end up averaging to the middle. So the number one mistake most people make is that I can be a high performer and just bang away every day. Doesn't happen that way for an Olympian. As we know in the room, it's 8 to 12 years of preparation for one event, typically. For special operations, very clearly targeted timelines and things where they hit their peak, but then they pulled off the line. And the group that is the worst at it is 2 groups, and in our elite performance framework, we work at the C-suite, right at the very tip, but our favourites is the founders programs we run. Both of those groups suck at sustained high performance. Because, and it's not a reflection of the outcomes, it's a reflection of what would be possible if they really did take some time off, rest, recover, and really focus. And I'm just putting that out there as a bit of fun, because there's no way to sustain the human system at any level of high stakes performance, literally for any more than about a week or two at a time, if you really take it to the very edge. So that's the lens.
So, Vicki, Lume focuses on cortisol and circadian rhythm. So I bet there are a few of these non-sustained high-performance people running on poor sleep and adrenaline. So what would the hormones tell us that we don't really know, and how are you approaching that? How are you using that?
Yeah, that really resonates with a lot of what we're uncovering at Lume. Honestly, we're seeing a lot of this. A lot of our early users are actually founders, and a lot of VCs as well, actually. But cortisol is a really great marker for uncovering some of that behavior that leads to things like burnout or poor recovery. And the fundamental rhythm that governs cortisol is actually called your circadian rhythm. And a lot of people have heard about it, but it really is this balance between rest and activity. And it's ingrained in every single cell in our biology. And it's governed, a lot of people are surprised to know, but by sunlight. We evolved for millions of years, not just us, but plants, animals, single-cell organisms in the light-dark cycle, and it shows up very clearly in our hormonal rhythms. So that's one of the things that a lot of people are finding when they start using Lume or experiencing Lume, is they start to understand that they're not a static being, but they're a dynamic, moving biological system, and that if you don't enhance and really pay attention to that rhythm, you can end up burning out. And that's where we see a lot of people with chronic fatigue, insomnia, not able to sleep and not able to perform at their best.
And perhaps heart attacks as well. So, Rado, take us through what happens on site when fast AI is sort of in the market and being used, and how does that have change and impact on the workflow for whoever's coming out to rescue or people around, and also obviously the outcome for the patient? And I think it would be helpful to just say a little bit how it works as well.
Yeah, I'm going to take a little more time to tell the story a little bit about how it started and what was the idea behind it. But I've always been inspired by innovation, and thank you for mentioning that we as a physician, we really care about patients' outcome. We're here to help people and provide an impact at a larger scale, not just one patient at a time. I was inspired by my mentors who are tremendous innovators in hardware and stroke devices, and I saw, history unfold in front of me when we were working and removing clots from the brain with devices were just invented in UCLA. But really, what inspired me was the trajectory in diagnostics, and there was a story about Holter monitoring transforming into Xiopatch, which was founded by a cardiology fellow in Stanford, and now Xiopatch is an industry standard for heart monitoring. But fast forward a few years later, Apple comes with a FDA clearance for iWatch for AFib detection. So now wearables is in the palm of your hand, in everybody's pocket. Everyone has some sort of wearable, and that wearable detects important signs of a disease or prediction of a disease about to happen. And I've always thought about how can we actually not just treat stroke, because we know how to treat stroke right now, but how do we diagnose it timely and have that tremendous impact and a bigger scale when we diagnose it as it happens and bring the patient to the right place where we can treat them. And essentially, one day at UCLA, one patient came who diagnosed stroke because he was trying to talk to Alexa, but the Alexa couldn't understand him. He was slurring his speech, and Alexa was not following his commands. He looked at the mirror, and he saw a facial drooping. He's like, I'm having a stroke. He pressed 911 button on his iWatch. And then this is how the idea conceived, okay, there's enough technology around us that we can harness to diagnose signs of strokes. And then the idea became reality after I was invited to speak at Bulgaria, where I'm from originally, with Bulgarian Neurological Society, Björn Gingelheim, the world leader in pharmaceutical leader in making TPA, which is a medication for stroke. And then we're sitting with them, and they said, why don't we just make a device that diagnose stroke? And I said, well, I have this idea, let's do it. And then fast forward a year later, we had like 300 patients that were from several major Bulgarian centers that we did a study on. We trained the algorithms, we filmed them. We used basically the video, the audio, the sensor that are embedded in every mobile phone to capture and track the most common signs of stroke. And then we published this data in American Heart Association and released it in an international stroke conference. And then the next thing I know is that they're doing an interview with me, and they're saying, well, this is amazing, this is in the media. And I went snowboarding here, I remember, at Mount Baldy. By the way, Mount Baldy is just an hour away, and believe it or not, in LA you can snowboard in April. And there was very poor reception there, and my mentor is calling me. He's like, Washington Post wants to talk to you because you have an amazing app that diagnoses stroke as it happens. And then I had to find a signal somewhere in Mount Baldy because it was very poor signal. So I went to their hut there, and there was like a Wi-Fi connection. I gave an interview in Washington Post. There was like 7 million impressions of that. So I saw the value. The value is there, but really there was a lot more friction on how to bring it to market. Who is the consumer? How do I actually bring it to the consumer? How to deliver it? How to monetize it? And essentially, the way we are starting is basically we're starting with the lowest possible friction. We're giving it to the paramedics who are not fully trained to do the stroke examination, bringing the phone in front of the patient, filming them, doing a few things. It's just basically a 30 seconds test. But ultimately, we want to actually bring it into the consumer as an integrated app with an additional digital biomarker data that actually would combine and would trigger the response, whether it's going to be heart rate variability, it's going to be changes in your posture that will actually make you to bring up the phone itself and do a quick exam and really understand that you're having a stroke or not. And that will actually work with alerting the proper system, where it's 911 or whichever country it exists, and drive you to the right place. And just in a few years, the way things will look like is going to be completely different than what it is right now. When you're riding a Waymo, you can only tell that camera is going to really watch you while you're there. And if, God forbid, something's happening to you, whether it's a heart attack or a stroke, that Waymo's not going to even call 911. It's going to just drive you directly to a proper place and alert the proper place. So before you even know it, me or my colleagues will be there to treat you. So this is the vision of Fast AI. Hope that makes sense.
Yeah, amazing. Thank you so much. So the previous panel talking about healthcare, and my 3 words would have been proactive over reactive. And I think everyone on the panel here is sort of working on how do we help that shift. And so I was really wondering about, with all the new technology and what's changing in the technology environment, in the data environment, also certain aspects of regulation or lack thereof, how are you thinking about making use of and integrating and merging all the new technologies together with what we start to know about all the connectivity between brain, heart, hormones, and how you're thinking about innovating in this enormous shifting environment?
That's not an easy question. I think you've got 2 ends of the spectrum really now as an opportunity. One is the general longevity, which is fundamentally just preventative health. And the challenge there is the data is bad, the context is non-existent, and the reality is, and the truth of the matter is, if you're doing nothing, anything you do will help. So even the data you're getting is going to be very clouded, so it doesn't really pay much. And the really good data is in healthcare because they've done the research. But that's a massive opportunity for all the entrepreneurs in the room, because as you said, it's every person in the world is a customer. What we're really excited about, and literally hot off the press as I walked up here, is we've been working for many years on a truly kinetic and pharmabiological digital twin, a predictive model. It's a causal model, so it's not a classic AI that's just making pattern recognition. And the reality was the twin, to cut a long story short, we just replicated 5 years of clinical trials with a very complex multiple myeloma cancer, and we replicated just using the proteomics genetics of the 100 people that went through, and it gave us in 30 minutes the 93% predictive capability off the twin. So I think where it's going to go, which is staggering, and then if you think about that, take 10% of that and give it to the longevity crowd, and it's going to be gold out there because their models aren't even close. They're not even predictive yet. So we're going to see this shift of these. Every type of data is allowed to be built in. The more data you build into these predictive twins, and this is the first generation. And today the announcement was a 5-year deal with IBM Clinical Sciences and their quantum platform, because we've hit the limits of the knowledge graph and the modeling in classical computing because it's just such a complex system. But quantum is one of the one things that the super engineers will know. It does actually work for that. So for us, I think we are going from, if I put my performance hat on, I can now take you two ways. I can either say, what do you want to look like in 6 months? And the model will predict the best optimized training models for you to be there. Or if you say in 6 months, I want to take X, Y, Z, or I want to look like this, it can reverse engineer it and we can actually model your training out. So we're actually getting to full predictive modeling in human health sciences, which will be a game changer. And the last part I'll say is that 93% is a pharma model, which is probably still not good enough. It has to be up a little higher. 96, 97, I think, is the benchmark. But the general user model, they just prototyped last week a version that just sits on your phone. 99 cents, doesn't even need to be connected to the cloud, and that gives you 30 to 40% accuracy. And that model can be given away to the world. So my 2 words would have been free healthcare.
Great.
Yeah, and kind of to build on that, I think where we sit, we really see one of the bottlenecks is that data. You know, we can't build better models without better data, and earlier today we were hearing a lot about friction and how friction is often something that holds back really great kind of discoveries. And in healthcare, there's been a lot of friction to get data today. I mean, talking about hormones, you have to go to a lab, get a needle, they draw it out of your body, they then send it to another lab, it takes 2 weeks, and then you get the data back. So just one data point. And as we all know, our hormones are fluctuating minute to minute, hour to hour, every day. So like we were talking about earlier, if you're just taking these snapshots, it means nothing. So any model you try and build on the existing framework of hormone data is not going to tell you anything. So that's really where we see the opportunities. If you can provide people with tools that can collect this novel data, you can now unlock AI in a way you could never before. And we really see, one of the sayings I say is a lot is, you got to feed the beast. And you got to find data to feed the beast.
I'll double down on that, because if you're an elite athlete, we may do up to 10,000 blood tests on you over your career. So we are getting as close to continuous as anybody has. And when we have that data, we can do what we're talking about here. But up until these sensors and this compute, but it's all happening now. So that it's just to double down on what you said, that the future is exactly what you're doing.
Just to add to this, I fully agree with this. And then we recently in Anderson, we had a pulse conferences which actually would involved all top healthcare executives, innovators, and C-level people in healthcare, and not just in industry, but in physicians as well. And the unanimous consent was that we're at a pivotal point where in healthcare, when actually, in a way, the message was, you're on your own. The patient's on their own. So the patients will actually become owners of their own data, whether it's in a digital way, digital wearables, continuous data, and then everything's going to be shifted as an outpatient setting, because the hospitals are overwhelmed. They cannot handle this amount of patients influx and over imaging, and a disrupted healthcare has to actually shift, and it's going to shift totally towards digitizing your health, and your health is going to be in your pocket, and you will know better than anyone what to do, and you're going to be your own doctor eventually.
Yeah, I sort of see it almost like we've seen in a lot of industries before, of this decentralization of healthcare, where now it's going to be owned by the individual and driven by the individual. And I think the centralized system is quite excited about that, to be unburdened by some of the lighter weight tasks that can be managed by the individual. So yeah, it's an exciting time.
I'm glad you made a comment actually about the ownership of the data. It's something I'm really hopeful about as well. But since we're sort of running low on time, because that's a great conversation, if you each were to pinpoint a specific either technology or habit or shift in healthcare that would really have a massive impact on our health span in the coming 10 years, what would that be?
I mean, aside from what we're building, I think honestly thinking a lot about how potentially blockchain technology can create an incentive system that can unlock a lot of value in the healthcare. So I imagine, for example, if you own your own wearable data and you can contribute that data to a centralized clinical trial and be rewarded for that through providing your data, I think that could really provide a lot of energy for and value for how the system needs to transition.
I fully agree with that concept. Just adding to it, continuous also access to specialists. You know, at the end of the day, you have to have the physician oversight, and the physician has to be able to look into your own data, and you should be able to have access to a physician relatively shortly, not in such a fragmented and convoluted way the way it is right now.
I think there's two parts. I think the first part is what we call the ecosystem, the health these new tech that is coming through that is validated in terms of wearables, different types of technologies, biomes, skin biome, all those advanced tech. You've got to stack these to get your full picture. So that's a capability that's just a technical challenge. But I think the massive upside is, I think someone told me recently, healthcare and wellness and longevity is like $9 trillion or whatever that number is. And I look at that space and I say, oh my God, and it's mostly wrong. Think of what the upside's going to be when you see what's possible. We see what's possible. We see the Formula One of human opportunity. So I think the big change is going to be, there's going to be so much money to be made and so much capital to be earned, and so that people are going to get healthier just because of the upside from a business perspective. To your point, staggering upside if you think of it. And you don't have to be right, you just have to be better. So that's the trick.
Yeah, it's a very exciting time, I think, for preventative health, and the ability to crunch huge amount of data is critical for a very complex system, which is our human body and mind. So thank you very much. It's been a delight.